Did you know that 8.7% of Canadians will experience generalized anxiety disorder in their lifetime? That's a significant portion of our population, and it underscores the importance of understanding this pervasive mental health condition. Today, we're going to delve into the world of generalized anxiety disorder, or GAD for short. We'll explore what it means, how it's diagnosed, and how frequently it occurs. We'll also examine the profound impact it has on individuals, families, and communities. And of course, we'll discuss the tools healthcare professionals use to assess it. We'll touch on how various factors can influence the development and progression of GAD, and talk about the resources available to those affected. Finally, we'll highlight the critical importance of early detection, treatment, and support. So, buckle up for an enlightening journey. Stick around as we dive into the world of GAD and its impact on our society. To begin, let us understand what generalized anxiety disorder is. In simple terms, generalized anxiety disorder, or GAD, is a long-term condition characterized by excessive, uncontrollable worry about a variety of everyday situations. These worries often occur without a specific reason and can be quite debilitating, affecting a person's ability to function in daily life. According to the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, also known as the DSM-5, a diagnosis of GAD requires the presence of excessive anxiety and worry occurring more days than not for at least 6 months, about a number of events or activities. The individual finds it hard to control the worry and experiences at least 3 of the following 6 symptoms: restlessness or feeling keyed up or on edge, being easily fatigued, difficulty concentrating or mind going blank, irritability, muscle tension, and sleep disturbance. GAD is not just about feeling anxious or worried. It's about these feelings being so constant and pervasive that they interfere with a person's quality of life. It's about feeling on edge, having trouble concentrating, or struggling with sleep disturbances for no apparent reason. The numbers might surprise you. When it comes to generalized anxiety disorder, or GAD, the statistics are quite revealing. According to the World Health Organization, about 4% of the global population grapples with an anxiety disorder. Now, let's zoom in on Canada. It's estimated that between 8.5 to 8.7% of Canadians aged 15 years and older will experience GAD during their lifetime. That's almost 1 in every 12 individuals, or approximately 2.4 million people. If we narrow it down to a 12-month period, the prevalence of Canadians aged 15 and older who will experience GAD is 2.6%. But what about the gender distribution, you may wonder? A study conducted in Alberta in 2016 found that the prevalence of GAD was almost twice as high in females, at 12.9% compared to males at 6.4%. It seems that GAD is a relatively rare condition before the age of 20, with the majority of onsets being amongst middle-aged females. Now, let's put Canada's prevalence estimate of 8.7% into perspective. This estimate appears to be toward the upper range of international estimates. For comparison, the prevalence is estimated to be 1.9% in Basel, Switzerland, 5.7% in the US, 6.1% in Australia, and it goes up to a staggering 31.1% in Christchurch, New Zealand. These figures underscore the significant impact of GAD on our society. They remind us that GAD is not a fringe issue. It's a common mental health condition that affects millions of individuals worldwide, and its prevalence in Canada is higher than many might assume. These numbers highlight the impact of GAD on our society. It's not just an individual's battle, but a societal issue that calls for collective awareness, understanding, and action. Let's not forget, behind each statistic is a person, a life, a story. This is why understanding GAD, its incidence and prevalence is of paramount importance. But what does this mean for the people, their families, and communities? Generalized anxiety disorder, or GAD, is not just an individual's battle. It is a collective struggle, affecting the lives of the person dealing with it, their families, and the communities they are a part of. Imagine a ripple effect, a stone tossed into a pond. The stone, in this case, is JD, and the pond is our society. The ripples, those are the impacts extending far beyond the initial splash. For the individual, the effects of JAD can be all-consuming. Persistent and excessive worry can lead to physical symptoms such as restlessness, fatigue, concentration problems, irritability, muscle tension, and sleep disturbances. The constant state of anxiety can also hinder their ability to work, study, or even carry out daily activities, leading to a significant reduction in their quality of life. WHO announced that anxiety disorders increase the risk of depression and substance use disorders, as well as the risk of suicidal thoughts and behaviors. But it doesn't stop there. The families of those dealing with GAD also feel the ripple effects. They may grapple with the challenge of understanding and supporting their loved ones while also dealing with their own emotional reactions. It's a balancing act, one that can strain familial relationships and dynamics. Moreover, Lawrence and colleagues in their 2019 study found that offspring with parents experiencing an anxiety disorder showed a significantly higher likelihood of developing anxiety themselves. Then we have the communities. JD can impact community productivity as individuals may struggle to maintain steady employment or contribute effectively due to their symptoms. The disorder can also place a strain on healthcare resources due to the need for ongoing treatment and support. Studies have found that GAD is highly comorbid with multiple physical health and psychiatric conditions, including cardiovascular disease, nervous system hyperactivity, major depressive disorder, alcohol abuse or dependence, and bipolar disorder, and has significant healthcare utilization and costs, particularly in primary care and emergency settings. The effects of JD can be devastating, but there are ways to assess it, and once we've assessed it, we can begin to address it. That's the power of understanding the impact of generalized anxiety disorder. It's not just about numbers and facts, it's about real people, real lives, and real change. And that's something we can all play a part in. It's like a domino effect, isn't it? But remember, understanding the impact is the first step towards managing it. And that's where the GAD-7 assessment tool comes in. This simple 7-question tool helps healthcare professionals identify the presence and severity of GAD. It's effective, it's efficient, and easy to use. The GAD-7, or Generalized Anxiety Disorder 7-item scale, is a self-report questionnaire designed to measure the severity of generalized anxiety disorder. It's a simple, quick, and efficient tool used in clinical and research settings. The GAD-7 consists of 7 questions that correspond to the most common symptoms of GAD as outlined in the Diagnostic and Statistical Manual of Mental Disorders, 5th edition. These symptoms include excessive worry, restlessness, easily fatigued, difficulty concentrating, irritability, muscle tension, and sleep disturbances. To use the GAD-7, individuals are asked to reflect on the last 2 weeks and rate how often they have been bothered by each symptom. The options are not at all, several days, more than half the days, and nearly every day, scored as 0, 1, 2, and 3, respectively. The scores for the 7 questions are then added together to produce a total score. The total score can range from 0 to 21, with higher scores indicating more severe anxiety. A score of 5 to 9 suggests mild anxiety, 10 to 14 indicates moderate anxiety, and 15 and above signifies severe anxiety. The GAD-7 is not just a diagnostic tool, but it also helps to monitor the severity of GAD over time. This allows healthcare professionals to track treatment progress and make necessary adjustments. While the GAD-7 is a helpful tool, it's important to remember that it doesn't replace professional diagnosis. It's a screening tool, not a definitive diagnostic measure. If someone scores high on the GAD-7, they should seek professional help for a comprehensive evaluation. It's also worth noting that the GAD-7 can detect other anxiety disorders, such as panic disorder and social anxiety disorder. It's a versatile tool with broad applications in mental health. The GAD-7 tool is an effective way to assess GAD, but how does GAD relate to the determinants of health? Determinants of health play a significant role in GAD. Let's delve into that a bit more. Determinants of health are the conditions in which people are born, grow, live, work, and age. These circumstances are shaped by the distribution of money, power, and resources at global, national, and local levels. When we talk about generalized anxiety disorder, we can see how these determinants significantly impact the prevalence and management of this condition. For example, socioeconomic status is a strong determinant. Individuals from lower socioeconomic backgrounds often have limited access to quality healthcare, which can lead to delayed diagnosis and treatment of GAD. Individuals with mental illness often find themselves in chronic poverty due to the onset of the condition, hindering their ability to attain sufficient education and employment. The absence of employment, in turn, adversely impacts one's capacity to earn a decent income. Gender, another determinant, also plays a key role. Statistics show that GAD is more prevalent in women than in men. In Alberta, for instance, a study in 2016 showed an estimated prevalence of 12.9% in females compared to 6.4% in males. Social support is another determinant to consider. According to Ruhafza and his colleagues in their 2014 study, social support is a significant protective factor against depression and anxiety, reduces the perception of situations as threats, as well as facilitates positive self-conceptions, social skills, responsibility, competence, and impulse control through dimensions like warmth, behavioral control, and psychological autonomy granting. Furthermore, coping skills play a part as a determinant in GAD. Ruhafza and his colleagues believe that coping styles involve cognitive and behavioral efforts to handle stress and individual demands, and they may have a buffering effect on psychological problems. Lacking active coping skills can result in avoidance of seeking help, denial of problems, and/or poor medical appointment attendance, while active coping styles generally result in better emotional adjustment to chronically stressful events compared to avoidant coping styles. Now, let's talk about community resources. These resources are a vital part of addressing the determinants of health and managing GAD. They include mental health services, support groups, and educational programs that aim to raise awareness and reduce the stigma associated with mental health disorders. Also, policies that address socioeconomic disparities and improve access to quality healthcare can go a long way in managing GAD. By understanding these determinants, we can better manage the condition and tailor community resources available to help. There's help available out there. That's right. For those navigating the waters of generalized anxiety disorder, you're not alone. In fact, there's a wealth of community resources at your fingertips, ready to provide support, guidance, and even treatment. In Canada, we're fortunate to have a range of resources geared towards mental health and specifically GAD. Let's start with the Canadian Mental Health Association, or CMHA. This nationwide organization offers a variety of programs and services to help Canadians understand mental illness, including GAD. From educational materials to support groups, the CMHA is a go-to resource for those affected by GAD. Next up, we have Anxiety Canada. This non-profit organization focuses on increasing awareness about anxiety disorders, promoting education, and offering resources. They provide self-help tools, including the MindShift CBT app, which uses scientifically proven strategies to help manage anxiety. In Alberta, the Alberta Health Services offers mental health services that include counseling and therapy for anxiety disorders. And let's not forget about online resources. Websites like Alberta Health, Alberta Primary Care Pathway, Centre for Addiction, and Mental Health offer online information and resources, including self-assessment tools, tips for managing anxiety, and links to additional resources. Last but not least, for those who prefer a more personal touch, the Primary Care Network in Alberta offers support groups, mental health counseling, and behavioral therapy services, both online and offline. These groups offer a safe space for individuals with GAD to share their experiences, learn from others, and gain a sense of community. These resources are pivotal in managing GAD. Now let's talk about the importance of early detection and treatment. Early detection and treatment can make a world of difference. Recognizing the signs of generalized anxiety disorder, or GAD, is the first step towards recovery. It's important to remember that GAD is not a sign of weakness, but a serious health condition that requires medical attention. Treatment options are varied and effective. They range from cognitive behavioral therapy, which helps individuals understand and manage their thoughts and feelings, to medication and even lifestyle changes like regular exercise and a balanced diet. Support from family, the community, and the healthcare system plays a pivotal role in this process. Encouragement and understanding from loved ones, combined with professional help, can significantly ease the journey towards recovery. The healthcare system, too, is instrumental in providing the necessary resources and treatments. It's crucial that individuals with GAD feel supported and understood, not just by their loved ones, but by their healthcare providers as well. Remember, it's okay to ask for help. GAD is a significant concern in our society, but it can be managed with the right support. We've looked at the facts and figures, seen the impact this disorder can have on individuals, families, and communities, and explored the tools available for its assessment. It's clear that generalized anxiety disorder is a significant issue, particularly among Canadian women, but it's also apparent that support is available, from community resources to healthcare professionals. Determinants of health play a crucial role in GAD, and understanding these factors is key to managing the disorder. Early detection and treatment are vital. With the right approach, the majority of people can lead fulfilling, productive lives despite their diagnosis. So, let's continue to raise awareness, promote early detection, and ensure that those struggling with GAD receive the support they need. If you or someone you know may be suffering from generalized anxiety disorder, don't hesitate to seek help. You're not alone in this.